Hello students, I am going to discuss Ken 12 observation. Many of the times question asked from this topic in AIAPGT and in UPSC. So let's start. Among 12 observations, ninth observation is the action of medicine on healthy human being. Therefore, 11th observations are there after a prescription. So in 12 observation, ninth observation is about action of medicines on healthy human being, and the other remaining 11 observations are there after a prescription. That is, what are the remedy reactions. First observation, a prolonged aggravation and final decline of the patient. So aggravation, prolonged aggravation, double aggravated sign, and final decline of the patient. Antisoric is too deep. It has established destructions. Case is incurable and the vital reaction is impossible. In incurable and doubtful cases begin with moderately low potency. 30 is the low enough for anybody or anything. When there is case is incurable and doubtful cases, when there is vital reaction is very low, then we starts with low potency, 30 potency. Prognosis is unfavorable. About prognosis, in first observation, unfavorable, medicine should be antidote. So medicine should be antidote and prognosis is unfavorable. Come to second observation. This is long aggravation but final and slow improvement. Long aggravation but final and slow improvement. But in first observation there is prolonged aggravation and decline of the patient. Here long aggravation and slow improvement. Beginning of some very marked structural changes, aggravation is very long, even many years. Then final and slow improvement occurs. Prognosis is favorable, but in first observation, prognosis is unfavorable. Medicine should be allowed to act in second observation, and in first observation, medicine should be antidoted. So in second observation, long aggravation, prognosis is favorable, medicine should be allowed to act, should not disrupt or interrupt the action of medicine. In third observation, aggravation is quick aggravation, short and strong with rapid improvement. Second is aggravation is very long but slow improvement. In third, there is rapid improvement, but aggravation is quick and period is short period. Strong aggravation, quick, short with rapid improvement. Reaction of economy is vigorous, improvement is rapid and long. Here improvement is rapid and long, but in second aggravation is long. No tendency to any structural changes in the vital organ. Structural changes, if any, found only on surface. Means here what is the meaning of structural changes? Meaning is pathology, about pathology. Here no pathology detected. If detected, found only on surface, that is on the skin, or superficial like mucous membrane. This slight aggravation of symptoms, slight aggravation, quick aggravation, short, strong, symptom occur in first hour, that is short period, first hour after the remedy in acute disease. So about in acute disease, third observation, during first few days in chronic disease, also in chronic disease for the first few days. Prognosis is good, medicine should be allowed to act. So first observation, prognosis unfavorable, second prognosis favorable, and third prognosis is good. So fourth observation, there is no aggravation, means no aggravation. sorry, there is no aggravation with recovery of the patient. Here is recovery of the patient, means cure. There is no organic disease, no pathology. Potency and dose exactly fitted to the case. It was only a functional disorder. Here only functional disorder, means SORA. Miasm is SORA. Highest order of cure in acute affections. So about acute affections, highest order of cure. Doubtful in chronic disease. So this fourth observation, mainly in acute affections. Recovery of the patient. Acute disease either lead to death or recovery. About fifth observation, all the four observation 1, 2, 3, 4 about aggravation. From fifth onwards, there is amelioration comes first and aggravation comes afterwards. So first one is amelioration, next aggravation comes. Remedy is only superficial. At that time, remedy is only superficial. It is only similar to the most grievous symptom, does not cover the constitutional state of the patient. It acts as a palliative. So remedy acts as palliative in this case. Only cover grievous symptoms, not cover the constitution. Patient is incurable and remedy is somewhat suitable. Remedy is suitable but patient is incurable. Case is palliative. Prognosis is unfavorable. More similar medicine is to be prescribed after fresh case taking. In this condition, we have to take fresh case taking, then the most similar medicine we have to prescribe. Next is sixth observation. Too short relief means their patient is okay. Relief of the symptoms, but relief is very short. Higher and highest potencies in curable cases. So this is about curable cases. Potencies are higher, highest potencies like 1M, 10M. Act long time. So the patient gets relief for long period. Too short relief may be due to a spoiling of the action of medicine by drinking liquor, handling chemicals, fumes of ammonia, etc. Why there is too short relief? Because of the obstacles. Obstacles adapted by the patient only. Drinking liquor, handling chemicals, fumes of ammonia. In acute disease, too short amelioration. Amelioration is too short in acute disease is due to high grade inflammatory changes. In chronic disease, too short amelioration is due to structural changes and organs are destroyed or is very precarious condition. Here in chronic disease, too short amelioration because of advanced pathology. Structural changes and organs are destroyed, but in acute disease, too short amelioration is due to high grade inflammatory changes. Inflammation is going inside the body. In acute cases, medicine should be repeated much oftener. In acute cases, we have to repeat medicine hourly or after 20 minutes, 15 minutes, whenever the case requires. Hourly, 2 hourly, or more similar medicines should be selected. Most minimum and frequent repetition in acute cases. In chronic disease, prognosis is bad and more suitable medicine is to be selected. Prognosis is the progress of disease, means fate of disease. Next comes to seventh observation. Here it is full-time amelioration. In sixth, too short amelioration. Here full-time amelioration of symptoms. It no special relief to the patient. There is amelioration of symptoms, but patient is not feeling relief. Presence of latent condition. Latent means hidden condition, or latent organic conditions means hidden tissue changes or organic changes, which prevents improvement beyond certain stages. Patient with one kidney, insisted tubercles of lungs, etc. Full length of time amelioration by several medicines, but no amelioration beyond a certain stage. Remedies act favorably, but the patient is not cured and never can be cured. Remedy act favorably, patient is not cured, never can be cured. It is suitable palliation for homeopathic medicines. Here, palliation of the symptoms. About 8th observation, some patients prove every remedy they get. That means patients are idiosyncratic, mentioned in aphorism 117. Patients are idiosyncratic, prove every medicine they get. Hysterical, overwrought, oversensitive patients. Idiosyncratic means the patient are although otherwise healthy but possesses a disposition, a tendency to brought into more or less morbid state by certain things, which seems to produce no impression and no change in any other healthy individuals. They are provers and prove highest potencies. During proving, they are not influenced by anything other than medicine. On them, medicine act like disease. Medicine act like disease. Remedy has a prodromal period. Remedy has prodromal period. Period of progress and period of decline. 3 periods. So what is prodromal period? Prodromal period is the time interval between infection and first symptom appearance. So this is important. Prodromal period. This is time interval between infection and first symptom appear. Their acute disease is cured by 30 or 200 potency. Chronic disease is cured by 30, 200 and 500 potencies. They born with this sensitivity and dies with it. That is about idiosyncratic patient mentioned in 8th observation. Now come to 9th observation about action of medicines upon provers. Healthy provers are always benefited by proving if it is properly conducted. So proving of medicines done on healthy provers. Constitutional state of the prover should be observed. So constitution is observed before proving and delayed them from the proving. So that was the person's symptoms only, not the medicine symptoms. So we should not consider what is before the taking the medicine. So constitution first observed of the prover, then delayed them from the proving record. If any change in the constitution, so what we have to record? Change. What the symptom occur, what the change in the constitution appear should be noted. Next is 10th observation. New symptoms appearing after the remedy. So after remedy there is new symptoms. Greater number of new symptoms coming. The prescription is more unfavorable. Why new symptoms are coming? Because the symptoms that are coming who belongs to the medicines. If the medicine is of similimum, then no new symptoms will come. Similar will annihilate the weaker one. Stronger similar will annihilate weaker one. New symptoms are coming, that means that are medicinal symptoms. So medicine is not similimum. After the new symptoms have passed away, the patient may settle down to original state, but no improvement takes place. For this we have to give most similimum medicines. Prescription is not truly homeopathic. So prescription is not homeopathic because of the medicine is not simillimum. Next is 11th observation. When old symptoms are observed to reappear. Old symptoms reappear. What is this sign? This sign is good sign. According to Hering law of cure. More the old symptoms reappear, more the disease is curable. Means disease is going curable. Old symptoms appear after the aggravation has come. Symptoms disappear in the reverse order of their coming. That is the Hering's law of cure. Symptoms disappear in reverse order. Symptoms that are present subside and old symptoms keep coming up. Reverse order, what is the meaning? First, if the patient have fever first, then patient have cough, then patient have something headache, then symptom will disappear in the reverse order. Like first headache will go, next cough will go, third fever will go. That prognosis is good, means disease is curing. All symptoms come back and goes off. The medicine must be let alone. Means if the old symptoms are coming and going, then we do not interrupt the action of medicine. Medicine must be let alone. What is the meaning of that? That is, patient is on the road of recovery. So patient is under recovery. Now next, 12th observation. Symptoms take the wrong direction, means direction is wrong. Transfer of symptoms, when we call the medicine is going in wrong direction. When transfer of symptoms from circumference to center. It means less vital organ to more important vital organ. From superficial going to deep. From surface to going to organs. Circumference to center. Medicine is selected only on the basis of external symptoms, that is sign and symptoms, manifestation of disease, and ignoring whole economy of the patient. Medicine must be antidoted. At that time we have to antidote the medicine, otherwise a structural change will occur in the interior, means pathology will develop. Example, treatment of skin disease or rheumatism of extremities. Violent internal distress settles in region of heart and spine, etc. So, all about 12th observation. Medicine must be antidoted in first observation and 12th observation. So, please like, share and subscribe my channel. Thank you.